Kia ora koutou, good afternoon everybody. Last night we received notification that a worker at the Grand Millennium Hotel in Auckland, the managed isolation facility, had tested positive for COVID-19. The test was done as part of our regular routine surveillance testing, and the worker and their family immediately went into isolation at their home. We've since had the rest of the family tested. 3 have returned negative results and 1 is under investigation. That person returned a weak positive result, and further work is being undertaken to get to the bottom of that today. We've started the contact tracing process, and Dr. Bloomfield will have more details on that shortly. I do want to be clear that while this case is connected to the border, we do see it as low risk to the community. Contact tracing, further genome sequencing, and that's all well underway, and we'll update you when we get more information on those things. I want to stress that the result was picked up during surveillance testing, so this is the system working as we intended. The person concerned works in an environment that requires diligent use of personal protective equipment, PPE, and regular cleaning. From the contact tracing so far, we've identified that there's been very limited exposure. A final point to note is that the worker concerned remains asymptomatic. This all bodes well. However, we are not being complacent. We need to continue to move quickly to mitigate any potential risk to the public, regardless of how low we consider that risk to be. So it's a good opportunity for all of us to remember that our public health measures, alongside our border measures and our vaccination program, continue to be incredibly important. And everybody, as always, has an important role to play in our COVID-19 response. Things like washing our hands and sanitising regularly, whilst it's become a little bit of a cliche, this continues to be an important way for us to stop the spread of the virus. Coughing into elbows and, of course, staying home when sick. Using the COVID Tracer app to scan into all of the places we visit and making sure that Bluetooth is turned on. These are all things that every New Zealander can do to help us stop COVID-19 in its tracks. All of these measures will help us to protect ourselves, our friends, and our families, and our wider families, from COVID-19. So I'll now hand over to Dr. Bloomfield for a bit more detailed information, and then we'll take your questions.
Thanks, Minister. Kia ora koutou katoa. Just continuing on from what the Minister said, some further information about the positive case reported last night and the household contact who returned a weak positive result and remains under investigation. So today we are retesting that family member and are also running the whole genome sequencing on both case A and the second family member. We should have those results available later today. They will help us determine what, if any, link there is between the MIF worker to recent cases at the Grand Millennium Hotel. Since the 1st of March, there have been 8 cases of people in managed isolation at this hotel. It is our largest managed isolation facility, so there have been 8 cases. All were identified on day 0 or 1 of their stay, which shows the value of our day 01 testing, and of those, 5 were in that sort of 2nd or 3rd week of March, which is the time that we might have expected this case to have become infected if it's linked, as we expect, to one of these cases. Should note case A and the family member both remain asymptomatic. Case A was at work yesterday, wore a mask for the duration. There were 2 colleagues who worked closely with case A. Both are now in self-isolation, and the case did not work for the 3 days prior to yesterday. Auckland public health officials are supporting the family's welfare needs and are arranging or speaking with family members about moving to the Auckland quarantine facility. They're also working rapidly to confirm case A's likely infectious period. Case A was on fortnightly swabs, and the last surveillance swab was taken on the 4th of March. The case had also, as I think you're aware, received the Pfizer-BioNTech vaccine as part of our border worker vaccination program. The first dose was on the 23rd of February, and they had just received the second dose on the 16th of March. I have one confirmed location of interest. This is the Mount Roskill Countdown, which was visited briefly by the case for around 10 minutes on Saturday, the 20th of March. More detail will be provided on the website, at the Ministry of Health website, and anyone visiting the countdown in Mount Roskill at around the time that will be indicated on the website, it's just been confirmed, needs to be alert for COVID-19 symptoms. If they develop those, of course, to stay at home, contact Healthline about getting a test. Any other new locations of interest associated with case A, or if we confirm the second case, will be notified as the information is confirmed. And just a reminder, the symptoms to be aware of course, are cough, fever, shortness of breath, sore throat, sneezing, runny nose, temporary loss of smell, and of course, as we've seen in more recent cases, muscle aches. Now, on vaccination, as noted, the new case had received both doses of the Pfizer-BioNTech vaccine as part of our wider vaccination program. It's in fact pleasing to see that this border worker, along with over 90% of other border workers to date, had been vaccinated. The second vaccine had been given just on the 16th of March. We know the vaccine is effective at preventing infection, preventing severe disease if a vaccinated person does become infected, and also there is emerging evidence for it preventing transmission. Now, full vaccination is classified as someone who has had both doses and 3 weeks apart and a period of at least 7 days after their second dose. And that's when we would expect 95% of people to be protected. In other words, to be immunised as opposed to vaccinated. This issue of how effective the vaccine is at preventing spread or transmission of COVID-19 is one we are looking at continually. I spoke this afternoon to our Chief Science Advisor, Dr. Ian Town. There's intense work and reporting on this around the globe, and essentially the evidence has been updated daily. At this point, he says the key thing we should be taking away is this vaccine is highly effective at protecting individuals, and seems to be doing a good job of protecting people collectively when higher rates of vaccination are achieved, as we're seeing in a number of countries around the world. So it remains critically important for all of us to take up that opportunity to be vaccinated. There is now an online tool on the covid19.govt.nz website that allows people to look and get an idea of when it is likely they will be offered the vaccine. Further to the border-related case, the one we're reporting, and that case under investigation we've just talked about, there are 3 other new positive cases, all in managed isolation, and 1 historical case to report. So the rolling 7-day average of new cases detected at the border is 5. 1 case is recovered, so our number of active cases is 68, and our total number of confirmed cases since the start of the pandemic is 2,112. We've had a total of 41 historical cases since the 1st of January, and out of a total of 300 cases. On the laboratory testing, there were 2,754 tests processed yesterday, reflecting the Sunday volumes, and the 7-day rolling average is 4,438 tests. I think I'll leave it at that, Minister. Back to you.
Thank you. We'll open up for questions.
Has the family been vaccinated?
No, they hadn't yet been vaccinated.
From the contact you've had, or from the contact the Ministry have had with the case, are you confident that that PPE was used appropriately throughout their time at the Grand Millennium Hotel?
Look, I can make an observation around MIQ facilities in general first, and then the specific case investigation. We regularly review the use of PPE and other infection prevention and control measures in our managed isolation facilities. The most recent review of this particular facility was done in January. It came back with some very mild to moderate recommendations for improvement. That's the case with almost every one of our infection prevention and control reviews. They come back with further improvements that can be made. There was nothing in that review that sort of rang any alarm bells to say actually there's some problems here. It was just the usual continual improvement cycle that we would expect, and that looks at things like whether PPE is being used appropriately. So the fact that the IPC audits weren't flagging up big concerns in that area, gives us confidence that the PPE and the IPC processes were being followed and were being used. In terms of the case investigation, nothing here has come back to suggest that there were any failings in that regard.
How likely is it that this case will lead to a change in alert levels?
Very, very, very low at this point. We would need to see some additional factors that we're certainly not seeing any evidence of at the moment. I do want to be clear, again, we've covered this ground a little bit before, but our first resort when we get a new positive case is not necessarily to look to alert levels. That's the sort of response that we would use where we're seeing transmission or when we're concerned about potential transmission within the community. There's no evidence to suggest that that's the case here.
What kind of procedures are being undertaken at the Grand Millennium now that this case has emerged from it?
So obviously there's a contact tracing process that goes on within the Grand Millennium. That includes looking at positive cases that have been at the Grand Millennium and trying to identify whether there are any epidemiological links or genomic links between the positive cases that might have been identified there, making sure that all of the staff testing is up to date and any close contacts with other staff members have been identified and any appropriate steps that need to be taken will be taken there. The Grand Millennium is one of our biggest, it is our biggest, in fact, managed isolation facility. It's served us very well. We haven't got concerns around the way that operates. But as with everything, you always have a good, thorough look at any positive case just to make sure that any risk around that case has been well contained. And that's what will be happening at the moment.
Dr. Bloomfield, can I just repeat, if the last swab that he took before this one was March 4, is that right?
Yes.
Is that appropriate, like for that line of work, whatever that it is this person does? That's 19 days ago. Like, shouldn't they have been tested more regularly?
Yes, so this person was on fortnightly testing. The swab, the fortnight came up last Thursday. There was a good reason why the person wasn't swabbed then, personal reason, and wasn't got that swab a few days after it was due, but hadn't been back at work and had that swab on Sunday before returning to work on the Monday. So there was a reason I won't go into, but certainly this is someone who has been regularly swabbed, is on that fortnightly schedule. The other point I did want to make is this case has routinely used the NZ COVID Tracer app, again, which is very helpful in terms of our ability to push out notifications to anyone who may have been at places of interest at the same time.
Are you able to say what their job was, like just generally?
Yes, this person's a cleaner at the hotel.
Do we know what variant this border worker has yet?
Not yet, no. We're expecting to get that either later today or early tomorrow. The genomic sequencing process takes some time. Yeah.
Are you expecting that it's likely transmission through surface fomite infection or?
Too early to draw any conclusions on that at this point. So the investigation process will look at any epidemiological link and any genomic link. Now, obviously, those two things go hand in hand. So if we identify a genomic link, it may well help us to identify a potential epidemiological link. We will review CCTV. My understanding is that the CCTV upgrade at the Grand Millennium is almost complete. There are still a couple of cameras that haven't been installed, but most of them have been installed and are operating. So that will certainly help us. It gives us visibility of most of the common areas. In that facility, and that will all help with the investigation.
What's the status of its air conditioning systems, airflow? There was obviously that effort to change up how the MIQ's air systems work due to the possibility of airborne transmission. So I'll make a more general comment first, and then again, Dr. Bloomfield might have more on the Grand Millennium in particular. Desktop-based reviews have now been done of all of our managed isolation facilities to look at their systems. Those are supplemented where there's a good reason to, as there was in the Pullman, with people going and doing physical inspections of those facilities. I haven't got the most recent update on the Grand Millennium, but from what I understand, the desktop review certainly was completed of that. I don't know whether
I don't have any specific information, but we can find that out.
Yeah.
Don't know, but we can find that out.
Yeah.
Were you able to get genomic sequencing from all of those 8 cases that have been in that hotel?
Yes, we were able to, and actually associated with those 8, there were another 2 family members in similar bubbles, or in different bubbles, 2 family members that also subsequently became positive once the family had moved to Jet Park. But we do have the genome sequencing on all those cases, and so that will be very helpful once we have the whole genome sequencing on our new case.
Almost to Jetpark?
Sorry?
All those 8 all moved to
Yes, that's
Jetpark?
routinely they go to Jetpark, either the day that the result comes back or the following day. But remembering that all were day 01, identified at day 01, and people remain in their room until the results of day 01 testing is returned.
So we typically do those transfers when it's safest to do so. So if we get a result late at night, for example, we'd leave those people in their rooms until the next day and then transfer them the next day. But generally speaking, if someone tests positive in that day 1 testing, they wouldn't spend more than one night in the MIQ, in the managed isolation facility that they have been assigned before being transferred to the quarantine.
Can you just update us as to where where saliva testing is for such workers so that they can be tested more frequently?
I'll ask Dr. Bloomfield to make a comment on that, but perhaps just briefly before I do, we have been making saliva testing available in these facilities. It's all about the calibration of the results of that to make sure that they are as reliable as a PCR test.
Yeah. So at the moment, the saliva testing is happening at our quarantine facilities. It's available to staff and is being trialled there still, but at the moment we're still maintaining our weekly or fortnightly PCR nasopharyngeal swab testing. I should say that the saliva testing is also PCR-based testing. It's just a different sampling method. But we can come back to you on with an update on where the saliva testing, how that's going in our quarantine facilities.
Dr. Bloomfield, a team of New Zealand researchers has taken a second look at that bin lid case from the Christchurch MIQ, and their conclusion is that it was airborne transmission that was the sort of vector for transmission, not the bin lid and surface infection. Have you read that study, and what were your thoughts on it?
Yes, well, I haven't read the study. I've read the summary of that study. I think over the last month or two, in particular, probably 3 months, there's been much more emergent evidence about the importance and the significance of airborne transmission of coronavirus and being a way that people become infected. And I think if we look at our more recent cases, the role of airborne or aerosolized transmission has been much more likely to have been the cause. And I think if we then retrospectively go back, knowing what we know now, it was probably more likely that the person who we initially thought it was through fomite transmission on the rubbish bin lid, it was aerosolized particles in the corridor. And I dare say that a lot of the actions that have been undertaken over the last month or two have been explicitly designed to reduce the likelihood of people being infected through aerosolized transmission, particularly by reducing movement of people outside of their rooms at the same time.
I think it's interesting, as someone who follows the